me try to say something.
Can you hear me?
Yes,ค่ะ
Okay, excellent. So, so this is a continuous today's lecture is about measurement principles and measurement approaches in research. And it's a continuation of our discussions about strategies for improving the methodological rigor of nursing research. One of the things that I often encounter are many questions about measurement. And so I want to share some of the underlying principles that we think about when it relates to measurement. This is not a full course, but some of the key underlying principles associated with measurement and some examples are about measurement approaches. Many of you will be in the position of creating data collection tools that include standardized measurement instruments as well as demographic and other single item questions that you may be interested for descriptive reasons. And the way in which we rate and organize our survey instrument and the strategies that we use also have really strong implications for the validity of our data collection. Okay. So may have implications for the validity of our data collection approaches. So let's get started today. So when I think about the questions that I typically get are related to measurement, it falls into 2 or 3 categories. The first is, how do I identify a standardized measure that captures the key construct that I'm interested in measuring for my study? The response to that is that it requires a very careful review of the literature in terms of what type of instruments, specific instruments have been used in other studies that are focusing on the exact same concepts that you are. And if there are multiple measures that can be identified, what are some of the decision points that we use to understand how we should select the most appropriate one? So decision points. If there is, try to identify whether or not there's a gold standard for the measurement of that construct that you're interested in. For example, quality of life. If there's a gold standard, that instrument should be used. If there are many approach measurement instruments that have been used, then the next step is to consider questions about length, meaning how many questions are there, because are there on that measurement tool? Sometimes we need to use briefer ones, and that's a consideration. But the most important considerations are those related to the evidence related to the reliability and validity of those measurement tools, how often that they have been used in the literature, are they consistent? Each of the studies that have used those, are they having each of them reporting consistently high reliability scores? And then finally, has this instrument been used translated into your country or used in the clinical population that you're interested in? So when we look at our example of quality of life, there are quality of life instruments that are for general health issues, and there are quality of life instruments that are used for cancer or quality of life in patients with chronic fatigue disorders. So we want to look to see, is there a standardized measure that's gold standard? If not, what are the measures that are available? Among those, how do you choose? length, the statistics related to reliability and validity, and whether or not it's been translated or developed in your own country. Where possible, if there is a good measure that's used in your own country, it's best to use that. If not, and you find yourself in need to translate an established document, it is really important to use validated measure approaches for cross-cultural translation. That typically includes translation, back translation, and establishment of CVI, and to establish some using a sample of at least 100 participants, some initial measures of reliability in your new country. So that's one of the first kind of types of broad questions that I'm asked. The second type of broad question relates to, can I just develop measures for my study? I'm not able to find any appropriate measures. Can I just develop them for my study? Typically, the answer to that is no. If it relates to a key outcome measure or a key predictor measure, either your key independent or dependent variable, it is not adequate or appropriate to develop your own measure and use it, unless, of course, you go through the rigorous process of developing your instrument and do instrument development, evaluation, and testing. The other question I get is that this measure is quite long. I just want to, use a select number of these items from a standardized measurement tool. That should never be done because the instrument was developed and validated based on use of all the items in the instrument. So selecting just a handful is very likely to reduce the validity of that instrument and certainly the reliability. If validity and reliability are not strong, then that introduces bias and eliminates our ability to trust the findings from your study. So I wanted to start this presentation about putting into context some of the questions that I am typically asked. And then this lecture will talk about why some of these issues need to be very consistently considered. All right. So what are the objectives then? First is to define measurement, to discuss the importance of measurement as cornerstone to nursing research, describe different types of measurement approaches and some of the advantages and disadvantages of some of the measurement approaches. And finally, thinking a lot about these questions of validity and reliability of measurement and data collection procedures. Okay. So what is measurement? The definition of measurement is the ability to assign numbers or scores to individuals in a systematic way so that the scores represent some characteristic of that individual and some characteristics when data are combined of a specific population. My research, one of my research faculty, one of my graduate program, Dr. Burright, he was the teacher for statistics. And he would always say, in order for something to exist, it must be measurable. And so many people sort of push back on that idea. They said, well, what about things like faith or belief? He says, even although faith is something that you can't necessarily put your hands on, there are ways in which we can measure, operationalize, and measure faith, religious faith, in an individual and a population. So his point was always remains, in order for something to exist, it must be measurable. So key features of measurement relates to quantification, that is, ability to assign numbers to that variable in a way that these numbers are meaningful, clearly defined in the variable in terms of how it should be measured, and then the development of standardized measurements of that variable and ways of interpreting the results from that variable. Okay. So in nursing research, and really all types of research, measurement is a cornerstone to nurses because it helps us to identify and quantify differences that we might see between people over time, over geographical locations, as well as health, both physical and mental health conditions. So that's why it is a cornerstone to all of our research. It's essential because in order for us to have good conclusions or good outcomes, or more plainly, the ability to trust our outcomes, it's reliant on strong measurement because that leads to better data, and better data leads to better conclusions about a topic that we're interested in studying. Poor measurement, meaning unreliable or measurements that are not valid or accurate, leads to poor data, and that can lead to results that cannot be fully trusted. So it indeed is a cornerstone of nursing research as well as practice. Because when we think about developing evidence, most of us are aware of the importance of research, um, measurement for developing evidence, but it's also important for practice. So measurement is also essential to the conduct of evidence-based practice in terms of understanding and measuring patient outcomes as a result of an evidence-based intervention or a change in clinical practice, evaluating the costs associated with an evidence-based practice, and looking at issues related to staffing and provider outcomes. So measurement is not just an issue for nursing research and nursing scientists, but all nursing scholarship, especially as it relates to evidence-based practice. So what are our goals of practice? Of measurement. The first is accuracy. Our measurement tools need to be accurate in terms of what we think we are measuring and in terms of the consistency in which we are able to measure it, right? So accuracy is our ability to differentiate between patients and cases correctly. So that is accuracy of a measurement. So if we have a measurement that's looking at determining HIV status, we want to have measurement tools and tests that are accurate in terms of differentiating patients who are HIV positive versus those who are HIV negative. We also want to think about that in terms of accuracy, in terms of level of depression or non-depression, or level of knowledge, higher levels versus lower levels of knowledge. So accuracy, being able to differentiate groups based on some outcome of interest. The other relates to sensitivity. That means our ability to detect differences in what is being measured, even if those differences are very, very small. So sensitivity is our ability to differentiate cases correctly, even if those measurements or amounts of that difference or amounts of that construct or disease are very low or slight in between as we think about patients groups. So good measures are both accurate and sensitive to the changes or the variability in the underlying concept. So when we think about our measurement of HIV, we want to be able to say that this tool is able to differentiate between those individuals who are HIV positive and negative versus negative. And this tool needs to be able to be sensitive to differences in viral load among those individuals who are HIV positive or negative. So it needs to be, for a good measurement instrument, it needs to be both accurate as well as sensitive. Another concept as we think about measurement is variability. So variability means that there are differences within an individual or across individuals in that concept or construct that we're looking to measure. Okay? So in terms of a measurement, when we're developing a measurement instrument, our first assumption is that there are differences in that concept that can be measured. And those differences might be within an individual, intra-individual, or intra-individual, or between individuals, inter-individual. So what's an example of an concept that is both varies on in terms of within the individual as well as across an individual? One would be a measure of depression. We know that levels of depression are very different among population groups. So if all of us here completed a measure of depression, we would see a great deal of variability that should look like a normal distribution. That tells us differences between individuals. But it's also important for us to measure changes within an individual over time or in response to a specific treatment. So, for example, we may be interested in measuring changes in depression level as a result of a medication or some other behavioral intervention that we're delivering to the person with depression. So at baseline, I might have a high level of depression, and if my medication is effective or my behavioral intervention is effective, we should be able to detect that those changes or improvements within an individual over time. So one key thing to keep in mind is if there is no variability in a construct, then we're not able to correlate it with other measures. That's why a key assumption is variability. So when we think about measurement in nursing research, it's very different than measurement in biomedical research, for example. So when we think about measurement of things such as height and weight, those are things that are objective and can be measured consistently using standardized approaches. But nurses are also interested in concepts that can be very difficult to define in terms of measurement. These concepts can be very abstract, and in order for us to be able to measure them, we need able to identify them in terms of very specific, concrete behavioral indicators. So what do we mean? Concepts such as hope, self-efficacy, or quality of life, these are all important nursing concepts that first needed to be operationalized in terms of understanding in terms of the concept analysis. What are components of the concepts? How do we operationalize those? What are the key indicators of those? And how do we measure those indicators? So that's the process of moving from an abstract concept such as hope to a measurement instrument. So thinking about hope, again, it's a abstract idea that many of us sort of have a general way in which we think about it. But there are some similarities and differences in how we can represent hope. So take a look at each of these four pictures. Tell me which of these pictures for you is the best representation of hope in the way that you personally understand hope. Okay? So, of these pictures, picture one, picture two, picture three, or picture four, in your way of understanding hope, which of these is the best representation? So, just come off mute and say picture one, 2, 3, or 4. In this instance, there is no right or wrong answer. We're asking the general question of, in the way that you understand hope, which of these pictures is closest representation of that? Who'd like to start? All right. Let's see. How to pronounce this one? Watch or read. Can I have you come off mute and tell me which of these pictures is the best for you personally, the best representation of hope? One.
I choose picture one, Professor.
And picture one, why?
I think is between like a type of house. I think we can go different environment, and it is the 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 flower is grow between environment, different environment. Yes, I think it.
All right. How about, let's see, the student here, Sutat. Sutat, in your opinion, which of these pictures represents hope for you?
I think the picture number 3, that is present the hope for my understand, because I think the 3 person, they wait for something that they want to have in that time, or they want to have something of their life for the future, and they wait for that. Okay, for present.
All right. Okay. How about Nata Ritai? Nahat Ritai. You recognize your name? Okay.
Yes, Professor. Good afternoon. For me, I think picture two,
Picture
and
two.
hands and a lot of birds and sun. I think as long as the sun is rising and we still have a hope in everyday opinion.
Thank you for that. Each of you picked a different picture and provided a different rationale, but each of these pictures spoke to you in different ways. And in your way of understanding and conceptualizing hope, you had different images. That's why when we think about general concepts, that we have to be very, very precise because they're abstract. And as you can see, people think in very different ways about them. But what if we provided more of a definition? Here, we have a definition of hope of the feeling that what is wanted can be had, or that events will turn out for the best. All right, now that is our new working definition. We're going to use this definition of hope. The feeling that what is wanted can be had or that events will turn out for the best. Now, which of these four pictures do you think is the best match for that specific definition? All right, and Kana? Ankana?
Yes. Good afternoon, Professor.
Good
I
afternoon.
choose picture number 4 ค่ะ
Prof.
I like writing this better thing are coming. I think about I hope for everything and I hope for study here.
Mhm. Okay. So for you, that picture number 4 is the best match for our definition of hope. Yeah?
Yeah,
Okay.
I like definition like this. Yeah.
Okay. One more person.
เฉลิมศรีค่ะ
Okay. Okay ค่ะ Good afternoon, Professor. I think from the four picture, I select the picture number 4 because
Mhm.
I like the word better thing are coming is clearly of definition. And from the picture, I like the sun is a symbol of the life and symbol of the fleshy. And the piece of paper maybe is not complete, but like a tear from the paper, but is writing by the word better thing are coming. It's like when you are feel hope, but the behind hope that something that not complete.
Excellent. Thank you. So
ค่ะ
notice the difference between what happened without a definition. We had a great deal of variability in people's understanding and feeling about what represented hope. But
Yes.
when we added definition, that we had more consistency, right? Both people who spoke were able to correctly link our definition with this single picture. That's sort of the idea that when we're moving from abstract concepts that can have a lot of very different meanings for different people, is that we have to do a concept analysis, identify key components of that concept that people can identify and agree on, and start to put that operational definition around that. So that I hope that was a good example of the importance of us in terms of clarity with definitions, especially as we're thinking about abstract concepts. And also the importance of if a tool has been developed to measure hope and standardized to measure a specific definition of hope, that we cannot just eliminate some questions because it would have been based on a concept analysis, items generated to reflect that concept, and a great deal of testing in order and refinement to come up with questions that are both valid and reliable. Okay. The next thing is that, again, when we think about how to move from the abstract to observable, we really think about theory. It is a way for understanding outcomes and behaviors. And here are several that are noted. So when we think about moving from the abstract to the observable, theory can provide help us by defining a term in terms of concepts, Then we moved from a theoretical definition to an operational definition. It's moving us from that abstract idea of hope, or in this case, spirituality, to something that is very, very measurable and consistently and accurately can measure our concept of spirituality. So the concept is spirituality. Our theoretical or our theoretical definition is a construct. Spirituality is defined as the broad personal search for meaning, purpose, value in life. And this spiritual health and life measure was specifically developed based on that theoretical definition to measure that specific concept. So this is an example of how we move from the more abstract, such as a concept such as hope, to a theoretical definition, to an operational definition in which we have a validated instrument to measure that concept. Okay? So as you can see, sometimes we will come up with a broad concept that hasn't been clearly defined or operationalized. And we want to use that for our dissertation. And you can, I hope now this exercise shows you why that is a problem in terms of accurate and valid research. Okay, so we think about theory, concept, indicator, and our variable. So this is something that when we go from this process, from this concept, broad concept, from our definition, then we have to think about how do we operationalize that and how do we come up with specific indicators that we want to measure. So moving to a measurable instrument means that we have our concept, we have our indicators of that concept, and we have the variables or the items or the instrument that's been developed to test those. So let's give an example. If I'm interested in the concept of wealth or wealthy or rich, my concept is wealthy. My indicators are a person's level of yearly income and how much assets they have, such as how much money in the bank or how much property they own. We go from those indicators of income to and assets to looking at two specific variables: income per year and the total value of their property. So that is the progression of a concept, indicators of that concept, and specific variables to measure that concept. Thinking about it in terms of my own research, the concept is nicotine addiction. Indicators based on a concept analysis of nicotine addiction are withdrawal symptoms and cravings. The specific variables that I'm going to use in my study to measure the concept of nicotine addiction is the nicotine withdrawal scale and the craving checklist. Okay? So I want you to, we don't have time now, and we're not together as a group, but I want you to think about this exercise. I want you to practice this by writing down what is a key concept that you're interested in, what are the indicators of that concept, and what are the specific variables that you will measure to capture that concept. So here's the example. My concept was nicotine addiction. My indicators were withdrawal symptoms and craving. And the variables that I choose to measure it accurately are standardized measures of craving and withdrawal symptoms. So let's have you practice that at home later today based on your own research. Okay. Other key concepts in measurement and this should be familiar to all of you from your measurement course. I just want to briefly review it again here, are levels of measurement, sources of measurement error, types of measures, and types of variable. So levels of measurement. Remember, for something to be real, it has to be measurable. And the way that we assign numbers to a concept differ by the type of data that they represent. So what do I mean by that? There are 4 levels of measurement: nominal, ordinal, interval, and ratio. Each of these different types or levels of measurement require different statistical approaches and it can tell us slightly different things about the data. So nominal data are used for counting something. If you want to know how many people have a red backpack, we can simply count that. And then we can use statistics, descriptive statistics, typically frequency, percentage, modes, to analyze those data. Ordinal data means a rank ordering. So if we were looking at preferences in our group of colors of book bags, and we have the choice of black, white, red, and blue, each of us would select a rank order of our preferences. And from that rank ordering, we can determine means, ranges, as well as percentile. In terms of intervals, that means like a Likert scale of level of satisfaction. So level of satisfaction with this topic today could range from 0, not at all satisfied, to 10, very satisfied. Each of us could be measured, and we could have a mean, standard deviation, and understand the variance. And then finally, ratios. Ratios are variables that have an absolute 0, the absence of something. And then there are different types of statistics. So depending on what type of question you're asking, it depends on whether or not you use a nominal, ordinal, interval, or a ratio scale. So here are some examples of each of these levels of measurement. So ordinal scale is naming and counting of something. So for example, one's country of origin, Nigeria. 1 is Nigeria, 2 is Colombia, 3 is England, and 4 is New Zealand. Those numbers in and of themselves are meaningless. They are only useful in helping us to organize the data about the country. So 1, 2, 3, and 4 are really meaningless here. They're only used in that they can tell us what percentage of people in the population selected their country of origin as Nigeria. Okay? So the numbers there are meaningless. They're just used to describe a category. Ordinal relates to an order of information. So again, the number in and of itself may or may not be is not meaningful, but again, to how to describe categories that vary that are different. So level of satisfaction is a rating, is opinion on satisfaction with the lecture. Some people will be not at all, some people will be somewhat, and someone will be very. These tell us something about level of satisfaction, but the differences between very and somewhat are not clear. So that we simply would do frequencies Whereas ordinal variables, there's a name and an order, and the proportion of the intervals is exactly the same. So that allows us to measure different things like temperature. And then finally, ratio is used to name things, measure things like height and temperature, things that have an absolute zero. So the type of variable, the type of data or your level of measurement is important for you to know so that when you're developing your measurement and you are using the correct statistics and you're interpreting the findings correctly. The second issue when we think about measurement relates to measurement error. The goal of measurement is to achieve accurate results, but every measurement that we take has some level of error. So a measured score, an outcome score on some measurement, such as depression, is a combination of the true score, the true findings of that individual's level of depression, and some level of measurement error. Every measurement that we take, that we make, has some assumed level of measurement error. So classic test theory tells us about measurement error, is that the assumptions are related to measurement error are that they're random across all scale items. So if the number, if the scale has a number of items for 1 and 10, the measurement error on each of these items is assumed to be random. They're assumed to be independent of one another and assumed to be independent of the true score itself. Okay? So that combination between a measured score is the true score plus the error, but we have the assumption that valid measurements have errors, but they're not systematic errors. So there are two sources of errors: random error that we would expect in all types of measurements, and systematic error. Which of these are more of a problem? Systematic error or random error? Random error is what we would expect from classic test theory, and that all items have some level of error that are random. That still, because it's built into measurement theory, it does not invalidate the test results when we see random error. However, when we see a systematic source of error, a source of error that is non-random, it's the same across items, and it is the same across individuals, this becomes a problem. So when we average out random measurement error, it equals 0, right? But if we random out, if we do an average of systematic error, it does not equal 0. So that causes problems in our interpretation. So let's give you an example. What's sources of systematic error? What are those? Those are sources of error that are consistent, they're recognized, and they are consistently wrong in a particular direction. So two types of systematic error are related to the measurement instrument itself or by the process of measurement. So let's talk about that in terms first of use of a thermometer to measure the temperature of a water in a container. A source of systematic measurement error would be using a thermometer that is inaccurate, that is off by 2 or 3 degrees Celsius. That would be a source of systematic error. It would be the same for every patient that we use that thermometer on, and it would be in the exact same direction. Another type of systematic error is one that relates to our process. So here, the thermometer touching the bottom of the beaker is closer to the source of the heat. So that will increase the temperature in a systematic way. So again, these will lead to error in our measurement. Okay, so sources of error relate to our participants, the situation in which we measure our data, the measurement instrument itself, or the researcher, or the person, so the researcher, the person who's measuring, taking the measurement, and our data collection instruments. Each of these four can be sources of systematic error. So that's when you're developing your measurement approaches, when you're collecting data for your dissertation, you want to make sure that the data collection, that your data instrument is free of errors. So I've had people who have conducted a study of depression and they left out one page of the depression inventory. And so it was missing 4 questions. That was a source of systematic error in one direction. So we need to make sure that our measurement tool is accurate, has all the questions. There's no error in copying. We may want to make sure that the data collector has been trained and follows the same procedure each time. And where possible, we want to make sure that the data collection situations are the same. So if I'm collecting a measure of knowledge, and for some of the participants, we're in a very quiet room where there's not a lot of distractions, and other data are collected in a place where there's a lot of conversation, there's a lot of noise, that person isn't able to concentrate as well. So we see that the situation, the environment that the person was collecting data can be a source of systematic error. Okay. All right. So 2 critical aspects of measurement: validity and reliability. Validity is what? So we'll start with reliability. Reliability is the consistency of a measurement instrument. So if the measurement is used with the same individual over time and that construct doesn't change, then we should get the exact same measurement result each time. All right? So it gives you the consistent scores each time you use that measurement. That is a measurement instrument that's reliable. How to improve the reliability of the measure? Make sure that you administer it the same time, at the same way each time. Make sure your data collection person is trained, and making sure the instrument is scored in the same way each time. All right, that's what reliability is, and that's how we improve reliability, by paying attention to the way that the instrument is measured. Validity refers to the accuracy of a measurement instrument. And that relates to the degree that you are accurately measuring the construct. There a question?
จ้า ฮัลโหล
Hello, yes, is there a question? Nope, okay. So validity is the accuracy or the correctness of the measurement instrument, meaning the degree to which the measurement instrument accurately measures the construct that you are trying to measure in your study. So Reliability and validity are both important constructs, but they're not really independent of one another when we think about the entire measurement instrument. So, true or false? An instrument can be reliable without being valid. True or false? Let's ask. Who will we ask this time? Someone that we didn't ask before. This person here. Dunlo? Dinlong. Can you come on, please? Dinlong. Can you come on camera and answer the question? All right. True or false? True or false? An instrument can be reliable without being valid. You're on mute now. Do you think that's a true statement or a false statement? Okay. Would someone else like to answer? And Conan, can I have you answer? Is this a true or a false statement? An instrument can be reliable without being valid. What do you think?
False.
False. The feeling is false. Okay. Who put your hand up if you raise your hand if you think that you agree with that? An instrument can be reliable without being valid. That person says false. It's actually true. You can consistently measure something without it being a valid measure of that construct. So you can develop a series of questions, develop to measure hope, and you can get reliable or the same responses each time. But that is no guarantee that it's a valid or it's accurately measuring hope. All right, so you can get reliable findings, the same finding each time without the instrument being valid. How about this? An instrument can be valid without being reliable. Can an instrument be valid without being reliable? Savitri? What do you think? What do you think about the question? Can an instrument be valid without being reliable? True or false?
In my opinion, I think an instrument can be valid without reliable.
Say one more time, please. True or false? I just didn't hear you before. Can you say your answer again? I just didn't hear you. All right. So the answer to this one is false. An instrument cannot be valid unless it is reliable. All right. So a good instrument is both valid and reliable. Right? Okay. So let me see. Let me get this out of the way so we can see. There we go. So to increase the likelihood that we have both valid and reliable results, it's important for us to use multiple methods or methods of measurement, unless there is an established instrument. Okay. All right. So just as a brief review, validity means, are you measuring what you intended to measure? Right? So the extent to which the data represent the phenomenon that's being assessed. Reliable means that you get the results are stable. If you use that same data collection tool and that construct doesn't change within an individual, then the results should be fairly reliable, fairly the same from time to time. And then accuracy is the variable is both reliable and valid. Okay? So just as here's a picture of what we were just talking about. So picture number 1 here, it is an example of a measurement instrument being reliable but not valid. Valid is if it captures the middle point here as an example, right? That's where the key construct is. So this is reliable. All the scores are clustering together, but it's not valid. The middle one is an example of something that's both reliable. All 3 arrows are in the exact same place, and the bullseye is right in the middle, and it reached there. The third is one that's both unreliable and unvalid. All right, so sometimes that helps people to understand that concept. All right. So what are some of the things that relate to measurement challenges? Those relate to the person. So we know from testing that the act of measuring something can change or influence what is being measured. The first is demand characteristics. So a participant changes their scores, their ratings, to accommodate what the researcher wants to know, right? So if I ask you about how satisfied you were with this lecture, and I was standing there watching you fill out your evaluation scores, there would be a lot of pressure for you to say highly satisfied, right? Because of the demand characteristics. The person who was lecturing was watching you do the evaluation. That circumstance has a tendency to change the measurement, accuracy of the measurement, because of the person's behavior. Hawthorne effect says that some behaviors change in response to being observed. And so if I said to the class, my goal now is to observe how good your posture is. From the time me saying that, in all likelihood, each of you in the room would straighten your posture. That's the Hawthorne effect. Changes in a person's behavior because they know they're being watched or observed. So if a person if I'm measuring violence and they're the kids on the playground know that there's a researcher there who's looking at measures of violence and aggression and bullying. If the children know that, they're most likely to change their behavior to not display aggressive behaviors. So in some circumstances, we can change a participant's behavior by them knowing that they're being observed. That's called the Hawthorne effect. Social desirability is a changing in one's behavior or one's responses to try to impress the person or to keep from reporting what is sort of taboo topics. So social desirability comes into play when we are asking people about illegal activities such as drug abuse, theft. So if I'm doing a measure of drug use, if I'm asking you directly in an interview about an use of illegal drugs, the vast majority of people will deny that. And so we really have, these are all examples of how we really have to think about what information that we're collecting and how the way that we're collecting it and the circumstances may directly impact our accuracy of our measures. Okay. Any questions? Oh, it says the sound is not working good. The sound is very quiet, not working good. Is it better now? If you can hear me well, could you say yes?
Yes.
Yes.
Okay, thank you. There were people in the chat box who were saying that the level wasn't good. Is it possible to turn down the fan, Celinda? Is it possible to turn down the fan, the background noise? It's quite loud. Okay, that's better. Thank you. Any question about measurement concepts or any of the concepts that we talked about? The ways that we think about abstract and move those to measurable indicators, issues related to level of measurement, issues related to classical test theory, such as measurement error, or questions related to reliability or validity. Any questions on those topics? All right. Now, let's move on to the second half of the lecture on measurement approaches. Measurement approaches is related to how we actually design our tools to answer for data collection. So this one here, is this an example of a survey or a questionnaire? What we see in front of us, is this an example of a survey or a questionnaire? Right? So a questionnaire is any written set of questions. A survey is both the question and the way of measuring that question both together. So this is a question, this first part, and this is a questionnaire, the second part. Okay? So questionnaire talks about the content, the specific question, and the survey is a broader term that describes the content, the method, and the way of analysis, such as the level of a measurement level that we talked about before. So questionnaires most of us are very familiar with them. They're used quite a lot in nursing and psychological research, behavioral research, because they're cheap and they're a pretty efficient way to gather a large amount of information from a large sample of people. So surveys can be, questionnaires can be done quite quickly and accurately. So, but questionnaires can differ based on the response required and the type and the way in which it's administered. So 6 major types of questions that most questionnaires use: open-ended, dichotomous, multiple choice, ratings or ranking, paired comparisons, or semantic differentials. I'm going to give you examples of each of these. So some of the standardized measurement instruments, you really don't need to think about this as much because the response items have the way that the participants responds to the question has already been established. But if you're developing a single item to collect descriptive information, or a few items asking about attitudes, you might want to keep in mind these different types of questions. So open-ended question, that's a more qualitative approach. So examples would be, what medications are you taking? How often do you take them? Where do you store them? So because there are many possible responses and we can't really know them, all the possible answers in advance, that's when we use an open-ended question. Okay. Open-ended questions are good when there are the response can be very varied, and we may not know what in advance, what are the possible responses. But if I'm if I'm asking a group of patients who are in a clinic and they might have a variety of different diagnoses, and we can't be certain, so we would use an open-ended question. What medications are you taking? But if we're in a diabetes clinic, we're doing ones looking at different medications to control glycemia, then we can, and there are 5 possible medications, then we would not use an open-ended questionnaire. We would list the 5 medications and have them circle the correct one. So this is an example of when open-ended questions are good, when we don't know all the possible responses. Okay? So the pros and cons, the good points allows the participant to express their point of view, but it can be very time consuming. People can sometimes give comments that are completely off topic, and you have to figure out a way to analyze the qualitative information that you obtain. Okay? The next type is a dichotomous question. That is, you ask a yes, no, or agree, disagree. Dichotomous means 2 choices. So, do you think a paper recycling program should be started at your school? Yes or no? That's a dichotomous question. It's very clear in which it's easy to understand. Most people will understand how to respond. It's short. But there are people who may think that there are circumstances in which their answer might change from yes to no. So, for example, are you for or against abortion? In general, I am for abortion, yes, but I might think, but I'm against a late uh, term abortion, such as in the 3rd trimester. So again, there might be some subtleties in the question or the way that they think about it that requires more than a yes, no answer. Okay? Multiple choice is when a person is able to answer either a correct answer or to give many opinions or to express many attitudes about a question. So sometimes there is one correct answer, or maybe they're able to use multiple choice to answer a question like, what forms of exercise do you do? Now, there's not a correct term, there's not a correct type of exercise. So a person might do swimming, or they might do running, or they might do yoga, or some other thing, and they're able to check all that apply. So those are 2 different ways in which you can use multiple choice to measure knowledge, to see if what percentage of people are able to answer the question accurately, or to collect information about multiple things that a person may be doing when there isn't one specific correct answer. So there are some benefits of multiple choice. They're easy to understand, and they don't really have to think too much about the question. But the downside is that it's possible to guess, such as on a multiple choice question when there's true. So there are some positive aspects of multiple choice and some downsides. Another is ratings. A rating is a set of categories that are used to measure an attribute, either quantitatively or qualitatively. So here's an example of a rating scale. This is the classically known pain rating scale. So it's used often for children to measure their pain. It can with no numbers. But with older adults, they can use that same rating scales, but it's because they can read, they also will do a qualitative explanation. So it's very simple to understand, but the reliability is quite low. Okay. Rankings. This is to try to have individuals put into a specific order their preferences or their feelings about a concept. So and this one is looking at what are the factors that are rated most important to you in terms of the work that you're doing. So you're supposed to rank order what's the first thing that's important of these 5 categories, what's second, third, fourth, and fifth. I have to tell you that when I have used this type of measurement, that people often do not use it correctly. There has to be a lot of training and education to get study participants to understand how to accurately use this type of scale. So my recommendation is to stay away from these type of rankings unless you're able to sit with the participant and clearly explain to them that they're supposed to use this list to rank, to check which one is their first choice, second, and etc. Okay? Paired comparisons. I personally like this one, but again, it can be very confusing to people. This is asking you to rate which of these 2 options do you prefer. I strongly prefer the option on the left versus I strongly prefer the option on the right. Me, I love it. But when I have asked students about this, who are not educated in the United States, they found this very confusing. So again, this is a type of question, response scale that you would want to be very careful about using to make sure that people can understand it correctly. Okay. Semantic differential. Again, this is sometimes a very useful way to gather information. So how would you describe this person in terms of these characteristics? Organized versus unorganized. So for each of these descriptors, we would be putting an X on the blank space in terms of which is closer to how we think about a person. So, for example, thinking about Dr. Matthews, would you say that Dr. Matthews is organized or very unorganized? Cold or warm? Modern or old-fashioned? Reliable, unreliable, or complex or simple? So here is where you can use, a person doesn't have to have a whole lot of literacy to be able to use this type of scale. But again, there are some problems with this as well. So again, there are many different types, which have their pros and cons. Again, you have to think about what is best for you, and your population. Okay? So is it structured or unstructured? Okay. Opened or closed? Or a mixed type of questionnaire, right? Using a questionnaire that uses the exact same response option is typically very quick to do. A person that an instrument that has different types of responses can have problems. A person has to read very carefully. Using pictures is good for children, people who have low health literacy, or a person who has lower cognitive abilities due to a brain injury. or even someone like myself who has a poor use of Thai, a picture like this would help me to be able to point to what I would want for my lunch, and not even if I didn't know the term for it. Right? So again, thinking about your population and what information that you want. Just like there are differences in survey types, response options, there are also differences in the ways in which we collect data. Here are 4 types that we can talk about that you may want to consider as when you think about your own dissertation. Mailing your questionnaire, telephone, computer versus in person. So mailing has a lot of advantages. It's not very expensive. You can ask sensitive questions because people can, it's private. People can answer it at home. They can complete it at their own pace. But there are lots of disadvantages, particularly is response rate. If you, in the United States right now, if you send out a questionnaire to 100 people, the average response rate will be only about 25 to 30%. So that is quite low. People who will fill out a survey, random survey that's mailed to them, typically are women, have higher education, are usually older, and that they don't have as much to do. So we now have a very biased sample. We have a low response rate, and we have bias in terms of who is likely to fill out that questionnaire. Okay? We also have a lot of issues with missing data. So there are some advantages, but disadvantages as well. The phone survey, again, could be used to collect data very quickly. That means you call people. It's not very expensive. You can, as you're asking the question, you can enter the data in real time. But the disadvantages is that it's very hard to do a long survey over the telephone. Many people, if they're not expecting your call, they will see it as spam and they will hang up on you. And it's not very well suited for sensitive questions. So in the past, we used a lot of phone surveys. That is not common anymore because people use cell phones. The cell phone numbers change pretty often. People will not often pick up a number that they don't recognize. And if they do answer and pick up the phone, the response rates are very low. Many people say no to wanting to answer a telephone survey that they're not expecting. Internet data collection is one of the newer trends and has been used for the last 10 years or so. In 2019, the vast majority of Americans use the internet. And among those, 43% said that they had completed a survey over the internet. So a lot of people have access to the internet, and some data suggests that nearly 50% at some point have used the internet to complete a survey. So there are lots of advantages. Not very costly. It eliminates the need for data collection, can be done very quickly. You can use SurveyMonkey or something else like that does skip patterns. So it can help to eliminate problems with if you have a skip pattern, or you can program it so that it will not allow for inaccurate answers to be entered. But again, we have a lot of missing data. We don't know if the same person is answering it multiple times, especially if you're offering some incentive. And you can't always be sure that people who are answering the survey actually meet your eligibility criteria. So I might say on an anonymous online survey. I am interested in young adults aged 18 to 24 who are students at Thomas Hart University. If I distribute that widely on Facebook, and I'm offering $50 to complete that study, you can bet that a lot of people will lie and say they're in the age range when they're not, or that they're students at Thomas Hart and they're not. So there are disadvantages in terms of um, data security, accuracy, and completeness. In addition, with the internet, there are some communities that have what we refer to as the digital divide. So in the rural areas, fewer people have access to reliable internet. And so that can be a problem. Also, people with lower health literacy are less likely to use the internet for much more than just social media. And there are other reasons as well. Okay. Delphi method. Now, this is a very interesting technique. And I think it's quite useful when we are trying to get some consensus from experts, right? So it's a strategy that can be used to get judgments from an expert panel that you're interested in. So let me give you an example. Some of the work that I do is around community engagement and increasing community engagement in research. What we find is that there so far there have not been objective indicators of good examples of best practices for community engagement and how to measure progress and in community engagement and how to measure expertise in community engagement. And so the Delphi measure would be one strategy that you would use to specifically interview and get the attitudes of experts, people in the country who were also doing community engaged research. So it allows for a structured approach to get a large group of experts, their opinion. It helps to generate a group consensus. Then it allows you to quantify the judgment of the experts and to assess their priorities. So it is a process, what we call an iterative process, means that it uses multiple steps that circle back to the same people to get a final result. So the first thing that you do is that you gather a pool of experts who will be providing feedback. You develop a systematic questionnaire that allows them to answer the question that you have. In your opinion, what are some examples of best practices for measuring community engagement? You will gather all of those responses from the experts, those qualitative responses. Then you develop a new rating score, a rating form that synthesized and has a listing of all the qualitative opinions. Then you ask them to send it out again. What is and with a different question, what is your level of agreement for each of these 12 indicators of good community engagement? Strongly, 0 is strongly disagree, and 5 is strongly agree. Then you collect the information again. Now you have some level of consensus among the group on which of the indicators that they thought were that the majority of the experts agreed upon. Then you might again keep that process going until you come up with a final listing of strategies to measure community engagement. Then you can write a final report and then go and use that as a basis for a larger survey. All right. That's an example of how to use experts in your field to come to some group discussion and consensus around a topic that you want to find more information about. So I had a student who was studying survivorship care planning among colorectal cancer nurses here in Thailand. They used a more of a survey approach, but they also could have used this Delphi technique to come up with use the experts to develop their survey and then to use that to measure in a larger sample. Okay. So there, again, like all approaches, there are definitely pros and cons to them, and those need to be considered. Okay. So at this point, stop sharing, and we can have time for a discussion about anything related to measurement in general, or any of the examples of measurement approaches that we just reviewed. Okay. Any questions? Which of these types of survey responses, survey approaches, do you typically use? Online, in person, telephone? Haven't started yet?
Anyone want to share? อาจารย์ลองสอบถามดูครับว่าแต่ละคนที่มีงานตอนนี้ใช้แบบไหนกันเป็นส่วนใหญ่ในการเก็บข้อมูลครับเป็นโทรศัพท์เป็นอินเทอร์เน็ตหรือวางแผนว่าจะใช้แบบไหนครับลองแชร์กับอาจารย์ดู
Let's go back here. There, here it is. For your dissertation, which of these approaches do you think you will use for distributing your questionnaires? Which of these 4 options, and there might be others, that you are interested in?
มีใครอยากแชร์ไหมครับว่าวางแผนหรือเคยใช้แบบไหนไว้ในการที่เก็บข้อมูลใน dissertation ของพวกเราครับสุทัศน์มีไอเดียไหมเอ่ยลองแชร์กับอาจารย์สักนิดไหมครับสุทัศน์
ครับอาจารย์ก็จากงานวิจัยนะคะเรื่องของการเก็บรวบรวมข้อมูลเนี่ยตอนนี้ก็เท่าที่วางแผนไว้ถ้าเป็นพวกquantitative research อย่างเงี้ยอาจารย์ก็จะเก็บจากเป็นพวกแบบสอบถามอะไรอย่างเงี้ยครับที่วางแผนไว้ก็คืออาจจะไปในทิศทางก็คือเรื่องของ STEM โดยรีวิวจากตัวแปรแล้วก็ใช้ตัวเอกสารเป็นตัวเก็บรวบรวมข้อมูลอย่างเงี้ยครับอาจารย์ใช้ questionnaire เช็คลิสต์อะไรอย่างเงี้ยครับ
ครับของสุทัศน์the guy who present about his how to accept the date he said that he gonna plan to use a survey collecting data based on the questionnaire that developed from the theoretical framework and then try to use the survey to collect those data
But how will you distribute it? Will you send it to people in the mail? Will you have an online survey? Will you approach people in the clinic? How will you collect your data?
ตอนนี้จากประสบการณ์ก็คือจะมีแค่แบบเราลงไปเก็บข้อมูลด้วยตัวเองแล้วก็อาจจะแบบมีผู้ช่วยวิจัยที่จะแบบเราเตรียมไว้แล้วก็ลงไปช่วยเก็บข้อมูลกับเราอย่างเงี้ยครับอาจารย์
ที่คลินิกหรือที่โรงพยาบาลอะไรอย่างนี้ใช่ไหมครับหรือ
ใช่ครับอาจารย์
Okay, he gonna collect the data by himself at the clinical settings or the hospital, something like that. Maybe help someone who help him to collect the data.
Okay, all right. So essentially an in-house questionnaire, in-person questionnaire. Okay, how about someone else? What is your strategy?
เด่นละอองค่ะ ค่ะ I have been to use the questionnaire by the paper questionnaire to collect the data from the participants, but in the future I plan to use the computer questionnaire to collect the data. Yeah, thank you, Professor.
Okay,
อา
all
จารย์
right.
ขออนุญาตถามค่ะอ่ะอ่ะสมมุติว่าถ้าเราใช้รูปแบบการวิจัยแบบ mixed method อะค่ะอาจารย์ตรงช่วงที่เก็บข้อมูลเรื่องของ questionnaire by telephone questionnaire อะค่ะเวลาที่เรา interpret อะค่ะมันก็จะมีเรื่องของสีหน้าเรื่องของสิ่งที่มันพูดถึงสมมติหัวข้อที่เราพูดถึงอะค่ะสิ่งเหล่านี้เวลาเรา interpret มาเป็น colleague ก่อนอะค่ะอาจารย์มันหมายถึงว่ามีมันเกิด มันจำเป็นถ้ามันมีข้อถ้ามันไม่ได้มีข้อจำกัดระหว่างการเทเลโฟนกับการเฟซทูเฟซอะค่ะจะแนะนำว่าควรเป็นวิธีไหนอย่างเงี้ยค่ะจะ
so ก็คือถ้าสมมุติเราทำ mix method ถูกไหมครับ แล้ววางแผนว่าจะเก็บข้อมูลอาจจะใช้เป็นเทเลโฟนใช่ไหม
ค่ะ
มันอาจจะมีประเด็นเรื่องเห็นสีหน้าหรืออะไรต่างๆ เหล่านี้คือคำถามคือเรากำลังสงสัยว่าน่าจะใช้เป็นวิธีการใดน่าจะทำให้ได้ Data ได้ดีกว่าผมเข้าใจถูกไหม
ค่ะอาจารย์แล้วสมมติค่ะแล้วก็สมมติว่าเวลาเราเวลาความน่าเชื่อถืออีกนะคะสมมติถ้า
Okay.
การขึ้นข้อมูลนะคะกับ
Okay, that is a very good question. Thank you. So she asking about she plan to do the mixed method research study, and she initially thinking about using the telephone questionnaire, but her issue is it the best appropriate or not, or she should consider to use other method, and how about the reliability of that method if she use, because if she collect the data by using the mixed method, maybe she have interview and to see a patient expression, something like that. So she just consider which you recommend for her, and how about the trustworthiness or reliability of the data that she gonna get from those.
That's a really good question. The first thing I would think about in terms of the use of the internet, so such as Zoom, to do a mixed method. So I'm assuming that you're saying that you would do your interview or your focus group using Zoom, and then follow up as your qualitative, and then follow up with doing the Zoom interview, the data collection over Zoom, or afterwards over the telephone. Is that right? Am I so using Zoom? Okay. It like all things, it depends. What does it depend on? The first is whether or not you're trying to collect data from people who are further away from you, that would have trouble coming to your site, either because of distance or because of illness. Doing telephone or Zoom or on other types of online interviewing can be quite effective. So depends on the reason that you're doing it. So
อาจารย์ก็บอกอันนี้เป็นช่วงแรกนะครับอาจารย์ก็บอกว่าอาจจะขึ้นอยู่กับสิ่งที่เราต้องการเนาะถ้าคนไข้สามารถมาได้เนี่ยก็จะง่ายต่อการที่เราจะสังเกตเห็นแต่ถ้าไม่ได้ด้วยอยู่ไกลหรือว่า disease ที่เขาเป็นเดินทางมาไม่ได้ก็สามารถที่จะใช้ Zoom ที่จะเห็นหน้าเป็นวิดีโอคอลที่น่าจะสามารถทำให้ดูข้อมูลน่าเชื่อถือได้
But so in that case, using Zoom or telephone increases access, right? The person that is ill, they wouldn't be able to travel to participate otherwise. But we also have to remember that the access to the internet is not the same in every community. So in the rural area, or based on age or other computer literacy. So only doing it by using the computer would reduce access for some people.
อาจารย์ก็เพิ่มเติมนะครับถึงแม้ว่ามันจะเป็น strategy ที่ดีที่เราสามารถเห็นคนที่อยู่ไกลๆได้ไม่สามารถเดินทางมาได้ได้เห็นหน้าได้สัมภาษณ์เนาะแต่ในกรณีที่ใช้ internet access เนี่ยมันก็มี limitation เหมือนกันก็คือการเข้าถึงของคนเหล่านั้นเนี่ยเนื่องจากคนเหล่านั้นอาจจะอายุเยอะอย่างที่อาจารย์ยกตัวอย่างอาจจะไม่สามารถอินเทอร์เน็ตไม่เสถียรสมมุติอย่างเงี้ยก็ทำให้มันเกิดการ reduce การ access เข้ามาก็จะเป็นอุปสรรคหนึ่งได้
So you really need to think about what is your population and who are you able to reach by using Zoom and who would you be eliminating by using Zoom? And it's the balance between those two factors, making sure you have people who are able to who can participate, who want to, but not choosing an approach that adds systematic bias to who is able to participate.
การก็เลยบอกว่ามันก็เลยขึ้นกับขึ้นอยู่กับสองเหตุผลนี่แหละครับว่าก็คือหนึ่งเราจะสามารถได้คนมาเนาะหรือไม่เนาะหรือว่าเราจะสามารถอะไรล่ะทำให้เขาคงอยู่ในคือเข้ามาแล้วก็ได้ข้อมูลโดยการใช้อันเนี้ยก็ต้องพิจารณาเอานะครับแต่อย่างไรก็ตามอาจารย์ก็บอกว่าพยายามที่จะหลีกเลี่ยง systematic bias ที่อาจจะเกิดขึ้นด้วยนะครับ
Now go back to your question related to reliability and validity. COVID taught us that we can collect interview data using Zoom. English, okay. Quite well. The only issue that we found, because you can record the audio, you can see visually, you can download it, you can have a lengthy or short. It has been shown to COVID to be very effective. Again, the only downside, or one of the downsides, is access, and it's not good for group discussion. One-on-one interview is just fine. It's harder for if you want to collect focus group interventions, meaning interview many people at the same time. Why? Just as it is when I'm teaching here, I can ask a general question, and if there are a lot of people who are not on camera or who are muted, nobody may say anything, right? That's a big risk factor. Now, if I call somebody's name, then they will respond. But that's different than people meeting in person and having a natural dialogue with one another about a topic. So fine for one-on-one, disaster for group.
โอเคอาจารย์ก็บอกว่าในช่วงหลังจากที่โควิดผ่านมาพอเราพูดถึงเรื่อง rely กับ valid ของการเก็บข้อมูลโดยการออนไลน์อย่างเงี้ยเนาะอาจารย์ก็ยกตัวอย่างว่าหลังโควิดที่ผ่านมาเนี่ยคนก็มาใช้การเก็บ data ออนไลน์มากขึ้นครับก็คือใช้ Zoom นี่แหละซึ่งมันก็ดีทำให้เราเห็น record ได้นะครับ easy ที่จะจัด set up เนาะไม่ต้องเดินทางอะไรอย่างเงี้ยแต่อาจารย์ก็บอกว่าในความคิดเห็นของอาจารย์น่ะการทำ individual interview ใน Zoom เนี่ย make sense ครับเพราะว่ามันเหมือนกับว่าเราก็ได้เห็นกันตรงๆเนาะก็ค่อนข้างโอเคแต่พอทำเป็นกรุ๊ปถ้าทำเป็นโฟกัสกรุ๊ปอินเทอร์วิวหรือทำอินเตอร์เวนชั่นออนไลน์เนี่ยก็จะมีปัญหาเหมือนอย่างที่อาจารย์ยกตัวอย่างเช่นตอนเรียนตอนเนี้ยบางคนก็ปิดกล้องแกก็ไม่รู้ว่าใคร participate อยู่กับเราไหมนึกออกไหมบางทีก็พอถามไปก็เงียบอะไรอย่างเงี้ยก็จะไม่รู้เช่นเดียวกันอาจารย์ก็เลยฝากประเด็นเอาไว้ว่าก็ลองคิดดูว่าเราจะเอาไปใช้ในรูปแบบใดในงานของเราครับ
The one exception to having a group discussion would be if you are interviewing experts who have the expectation that they're there to give their opinion and they agree to do that, and or people who are very, very interested in talking about and are motivated to participate. You can never, with the exception of the experts, you can never really know for sure if if a group of strangers in this type of format will participate. It's just too big of a risk.
อาจารย์บอกอีกอย่างหนึ่งว่าอย่างเช่นถ้าสมมุติเราทำการสัมภาษณ์เนี่ยแต่กลุ่มคนที่เราสัมภาษณ์เนี่ยเป็นเอ็กซ์เพรสเป็นคนที่สนใจเรื่องนี้จริงๆถ้าเป็นกลุ่มก็อาจจะยังโอเคเพราะว่าเขาสนใจในเรื่องที่เรากำลังจะทำจริงๆเนาะแต่บางทีเนี่ยคนที่ไม่ใช่เอ็กซ์เพรสเพราะว่าส่วนใหญ่เอ็กซ์เพรสเนี่ยก็จะพยายามมีอินเตอร์แอคถูกไหมหรือคนที่ไม่ได้สนใจเนี่ยก็อย่างที่บอกประเด็นก็คือเราก็เลยไม่แน่ใจว่าถ้าทำออนไลน์แบบเนี้ยมันจะเรื่อง valid เนี่ยมันจะตรงกันกับที่เราทำแบบ in person หรือเปล่านะครับ
So great questions. The short answer is yes. For individual mixed method interviews, you can do. Interview one-on-one, face-to-face like this, and ask them survey questions, and you complete it for them. Or alternatively, you send them the link to the survey in advance. They fill that out, and then you check it before you meet one-on-one, determine if there's any missing data or any problems, and then you collect the second half of the interview data.
I'm sorry ไมโครโฟนไม่ค่อยดีเท่าไหร่ พอจะเข้าใจประเด็นที่อาจารย์สรุปไหมครับโอเค very good ครับมีคนใครมีประเด็นเนี่ยอยากให้ดิสคัสกับอาจารย์แบบนี้ครับเราจะได้เห็นทิศทางเราไปเลยเนาะว่างานเราจะเป็นยังไงนะครับหรือถ้าตอนนี้เก็บข้อมูลอยู่แบบนี้แล้วมีอุปสรรคอยากจะลองคอนซัลท์อาจารย์ผมว่าก็น่าสนใจเช่นเดียวกันเนาะมีไหมครับ So I have my personal question right so far right now. Once I apply, I think everyone who gonna apply for IRB and try to use the online data collections, even though the survey or whatever. So IRB committee always asks back how's about the trustworthiness of that data collection. For example, if you say that participants have to be 18 and over, have to be like Thai nationality or whatever. And IRB always asks, how do you know they're gonna be 18 and over? How they're gonna be Thai nationality? You understand what I mean? ผมถามอาจารย์ว่าปกติเวลาเรา apply IRB แล้วก็จะมี criteria ของ participant ถูกไหมครับอย่างเช่นยกตัวอย่างง่ายๆคือ18 ปีขึ้นไปแต่เราเก็บ data ออนไลน์เนี่ย IRB ก็มักจะถามว่าในเมื่อคุณเก็บ Data ออนไลน์คุณจะรู้ได้ไงว่าเขาอายุ18 ปีขึ้นไปว่าคุณไม่ได้เจอเขาก็จะเป็นประเด็นที่เป็นคำถามของ IRB ค่อนข้างบ่อย How do you think about this?
Okay. These are questions in IRB that we see quite a lot. A good strategy is, first of all, collect the research articles in which online data collection of this sort is an accepted practice among behavioral and nursing researchers. So establish whether it's based on expert opinion, a paper that's been published that states expert opinion, whether it's looking at it based on a systematic review or meta-analysis that looks at and tries to evaluate the trustworthiness of this type of data. Or the statements that we recognize from the experts from the paper citations, that we recognize that there are, like with all surveys, there are potential sources of error. So a person could come to me and I say, you have to be 18 years older and older, Thai national, blah, 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 all these things. Unless I collect their identification card, which we never do, they could be not telling the truth about their age. So in all types of survey data collection, the field recognizes that there are some sources of error that we see as acceptable, right? And that's the first thing, that in the field, this is a recognized strategy. There are limitations, but the field has established that this is a valid measure despite those potential sources of error. The second one is that you clearly put your eligibility criteria and you're asking for trust in doing so. And then the third is that your incentive can't be too high because that will increase the likelihood of people incorrectly doing the survey for the money. Most people who do not, the survey does not apply to, will not sit for 30 minutes and do a survey that they're just making up the whole time. A few will, but those will be outliers. And again, all sources of random error average out. And so that will be fine. And then the fourth, is that sometimes we are able to embed a question or two within the survey that gives us a little bit of information as to if this person really is a part of the target population. So what would be an example of that? So if you're doing a screening measure of diabetes, right? And you ask a question that only someone with diabetes would know. What's your A1C level at your last testing? Now, somebody might have forgotten, but most people have a rough sense of what the A1C level is, and two, what their general scores are. So if you embedded in those questions and someone skips it or doesn't know what you're talking about, then that might give you some evidence that they're not they're false participant.
โอเคครับอาจารย์ก็คือที่ผมถามเนาะว่าเราจะมั่นใจได้ไงว่ากลุ่มตัวอย่างที่เราจะ recruit ออนไลน์เนี่ยเขามีไครทีเรียตรงกับสิ่งที่เราต้องการจริงๆเพราะว่า IRB ก็มักจะถามมันอย่างที่ผมทำวิจัยไปก็จะถามรู้ได้ไงว่าเป็นเด็กมหาลัยอะไรอย่างเงี้ยเนาะวิธีหนึ่งที่อาจารย์แนะนำก็คือก็จะมีอยู่4อันแรกก็คือให้เราcitation ครับในส่วนของบอกว่าการเก็บข้อมูล data ออนไลน์เนี่ยเป็นสิ่งที่ acceptable คือยอมรับได้เป็นมาตรฐานนะครับผม add up อีกอย่างหนึ่งคือfor my previous study I put the information that there is no difference between online data collection and on-site data collection ก็คือหา reference มา support ครับว่าการเก็บข้อมูล2วิธีนี้ให้ผลที่ไม่ต่างกันนึกออกไหมมันก็จะเป็นการช่วยยืนยันในระดับหนึ่งได้ว่าถึงความน่าเชื่อถือของการเก็บข้อมูลแบบออนไลน์ซึ่งมีครับก็จะมีงานวิจัยหลายๆแบบแต่ว่าเราก็ต้องไปค้นเนาะนะครับอันที่สองก็คือให้อธิบายลงในconsent form เนาะก่อนที่เขาจะทำเนี่ยให้เขาพูดว่าเหมือนกับมีข้อความที่บอกเขาว่าขอให้ตอบข้อมูลตรงตามความเป็นจริงของท่านเพื่อเป็นการยืนยันเนาะนึกออกไหมว่าเขา18 ปีจริงสมมุติเนี่ยเป็น criteria ถูกไหมก็คือมีข้อมูลบอกว่าขอให้ตอบตรงตามความเป็นจริงซึ่งก็จะสามารถช่วยได้นะครับอีกอันนึงที่อาจารย์ได้พูดถึงก็คือเรื่องของการที่what is the third one I forgot that I'm so sorry
No.
เดี๋ยวนะ I'll be talking about the add up some reference on that thing and specify a statement that please answer the truth and answer something like that and I remember the fourth one อาจารย์บอกว่าอย่างอันที่4ก็คือถ้าสมมุติเรามีกลุ่มตัวอย่างของเราที่อาจารย์ยกตัวอย่างเป็นกลุ่ม DM เนาะแล้วอาจจะมีคำถามบางคำถามที่แทรกอยู่ในเซอร์เวย์ครับที่ถามเกี่ยวกับ DM และเราคิดว่ากลุ่มคนที่เป็น DM มักจะรู้เช่นอาจารย์ยกตัวอย่างเรื่อง level H1C something right in DM patients that most ที่คนที่เป็น DM ส่วนใหญ่มักจะรู้และสามารถตอบได้ซึ่งถ้าตอบได้ตรงนี้เราก็จะสามารถ assume ได้ในระดับหนึ่งว่ากลุ่มคนกลุ่มนี้เป็นกลุ่มที่เป็น DM เพราะคนที่ไม่ใช่ DM ก็จะไม่ familiar กับ level H1C อะไรต่างๆนั้นถูกไหมครับเหมือนผมเนี่ยผมก็จะจำไม่ได้แล้วมันคืออะไร นึกออกไหมเพราะว่าเราไม่ได้เป็นเนาะ Do you remember the third
It
recommendation
fell out of my head.
ครับก็ใครจำได้อันที่3บ้างที่อาจารย์พูดมีจำได้ไหมลองแชร์ดิ
clearly eligible criteria ไหมคะอาจารย์
ลองเล่าสิครับลองเล่าสิครับ
we should set the clearly of eligible criteria of participant and that's why it can be help us to like to get the participant who with like a target population of our study.
I remember now. So by clicking this button, you're confirming that you are over age 18.
Okay.
Right.
โอเคก็มี clearly description of participant นะครับคืออธิบายอย่างเคลียร์แล้วก็อาจารย์ก็พูดถึงว่าอาจจะมีฟังก์ชันเพิ่มเติมว่าถ้าคุณคลิก agree เหมือนกับเป็น double check เนาะอันแรกอาจจะเป็นแค่เช็คครั้งแรกว่าเหมือนกับว่าคุณยอมรับไหมใช่ไหมคุณยอมรับไหมอย่างเงี้ยแล้วก็อาจจะมี double check please confirm again เหมือนเวลาเราทำ survey อะไรบางอย่างที่จะมีข้อคำถามเพื่อ reconfirm ว่าตกลงคือคุณอายุเท่านี้จริงอยู่เป็นนักศึกษามหาลัยนี้จริงอย่างของผมเนี่ยก็ให้คลิกอีกครั้งหนึ่งเพื่อ reconfirm their identity to be matched with the study criteria. Okay, yeah.
So mostly when we're trying to help the IRB understand the work that we're doing and the methods that we're using, the best practice is to have several citations from the literature that's doing the exact same thing that you're doing that talks about it's been recognized as an acceptable standard of means for data collection. You can acknowledge that there are some limitations, but that researchers have agreed that all data collection contributes to some degree of bias. But in most studies, like you're saying, when we compare online versus in person, we don't see, it's not usually systematic error. We don't see many differences. As a result, we are moving forward for the other benefits of research.
อาจารย์ก็ยังให้ไอเดียกลับมาเรื่องของการ add reference หรือ citation ที่ยืนยันครับว่าการเก็บข้อมูลออนไลน์เนี่ยเป็นอะไรมาตรฐานแบบหนึ่งแล้วไปหา citation มาหรืออย่างที่ผมยกตัวอย่างว่ามีงานที่คล้ายคลึงกับของเราเก็บข้อมูลด้วยวิธีเดียวกันลักษณะแบบนี้แล้วก็ไม่เห็นความแตกต่างของข้อมูลที่เก็บนึกออกไหมมันก็จะมีงานบางชิ้นที่ระบุเอาไว้ซึ่งตรงนี้ก็จะเป็นประโยชน์ผมจำได้อีกอันนึงที่ผมเคยใช้ตอน apply IRB ของผมก็จะอธิบายว่ากลุ่มตัวอย่างของเราเนี่ยเป็น age over 18 เนาะคือเป็นกลุ่มคนที่เรียกว่าบรรลุนิติภาวะถูกไหมครับซึ่งเราเชื่อว่าเมื่อบุคคลบรรลุนิติภาวะเนี่ยการตัดสินใจที่จะ participate สิ่งใดสิ่งหนึ่งเนี่ยเป็นสิ่งที่เขาเต็มใจจะทำด้วยตัวเองอยู่แล้วนึกออกไหมก็คือใช้ลักษณะของการบรรลุนิติภาวะของ age over 18 เนี่ยมาช่วยในการอธิบายว่าเพราะฉะนั้นเนี่ยการที่เขาจะตอบอะไรขึ้นมาเนี่ยมันก็เป็นสิ่งที่เขาได้พิจารณากันกรองมาโดยไม่ได้ถ้าอายุต่ำกว่า18อาจจะน่าคอนเซิร์นเนาะนึกออกไหมแต่อันนี้คือ18ปีขึ้นไปแล้วก็ถือว่าเป็นผู้ใหญ่พูดง่ายๆนะครับก็คิดว่าคำตอบที่ได้เนี่ยก็คือน่าเชื่อถือในระดับหนึ่งแล้วก็นึกได้เมื่อกี้แวบขึ้นมาเหมือนอาจารย์พูดI remember แต่อาจารย์พูด add up ขึ้นมาอีกอันนึงว่าจริงๆแล้วเนี่ยการเก็บข้อมูลด้วย in person คือเห็นหน้าเนี่ยปกติเนี่ยถ้าคนจะไม่ตอบตามความจริงมันก็เกิดขึ้นได้อยู่แล้วจริงไหมไม่จำเป็นจะต้องเป็นออนไลน์อย่างเช่นคุณเอาคนไข้มาคุณจะสัมภาษณ์เขาว่ามีเพศสัมพันธ์ครั้งสุดท้ายเมื่อไหร่ถ้าเขาจะไม่ตอบตามความจริงถึงแม้จะเป็นออนไซต์เห็นหน้าเขาก็ไม่ตอบตามความจริงอยู่ดีเพราะฉะนั้นเนี่ยแล้วเราก็ไม่ได้มีเรคคอร์ดอะไรที่จะมายืนยันเพราะฉะนั้นเนี่ยก็เลยอาจจะเป็นอีกเหตุผลหนึ่งที่อย่างที่ผมบอกว่าอาจจะพูดเหตุผลนี้แล้วก็หาตัวงานวิจัยอื่นๆที่มารองรับว่า is no different between การเก็บข้อมูลทั้งสองอย่าง so I give them more example on the previous study that I apply ARB and describe that the age above 18 they maturity to
Mhm.
make a decision on the answer this question. So
That's right.
it can be something that we can transfer, that the answer that we get from them is past their critical thinking, something like that, and can be like a rely on the trustworthiness on that thing.
Yeah, yeah. So remember when in our earlier lecture when we were talking about grant review, grant applications and how to be successful, and we said that a part of the issue is that keeping in mind that the reviewers are humans and that evaluation is a human process. The same thing with IRB members. You have to have an approach to your responses to the IRB that keeps in mind that this is a human process, that sometimes they will have their opinion, sometimes they will have their arrogance, sometimes they will have their misinformation. And so, one strategy that I have found to be successful is to um, acknowledge what the IRB reviewer is saying, and then systematically discuss why the approach that I'm taking is also appropriate. So, for example, let me give an example. Um, if I'm collecting in a survey information about smoking status, someone on the IRB committee will say, up, I read that that objective measure is the gold standard for smoking studies, and this person is using an invalid approach. You cannot just ask them, you have to bring them in and do an objective measure. That's the feedback I get, hypothetically. I would say to the reviewer, yes, the reviewer is correct that in randomized clinical trial intervention research, objective measures have been established as the gold standard, and self-report is viewed as inaccurate. However, epidemiological and survey research methodologists have also established that collection of tobacco or smoking data via surveys, anonymous surveys, and on the population level is that we see very little misinformation or inaccuracy that's reported. As consequently, in order for us to establish information about prevalence of a behavior, estimates of prevalence of a behavior in a large population, the scientific community has come to consensus, reference, that self-report is an acceptable and valid measure of data collection in this related to this project.
ครับอาจารย์ก็ได้ยกตัวอย่างอีกอันนึงเนาะว่าอาจารย์ก็เคยเจอปัญหาเมื่อตอน apply IRB เกี่ยวกับ smoking cessation คือเรื่องที่อาจารย์ทำอยู่ซึ่ง IRB ก็ถามเหมือนกันว่าวิธีการที่อาจารย์ทำเนี่ยมันไม่ valid เนื่องจากปกติเขาทำกันแบบนี้อาจารย์ก็ตอบว่าจริงอยู่ว่าไอ้วิธีการที่ IRB พูดถึงเป็นวิธีการที่ valid แล้วก็เป็น gold standard คือเป็นเหมือนมาตรฐานแต่ณปัจจุบันนะเขาก็มีงานวิจัยต่างๆที่ออกมายืนยันก็คือเหมือนกับที่เราเคยพูดกันไปตอนแรกกันนะว่ามีงานวิจัยต่างๆที่ออกมายืนยันว่าในปัจจุบันเนี้ยการเก็บข้อมูลด้วยวิธีการเนี้ยมันมี missing little missing มากหรือไม่มี missing เลยมันเทียบเคียงกันได้เพราะฉะนั้นในตอนนี้ด้วยวิธีการ study design แบบนี้การเก็บข้อมูลแบบนี้มันก็เลยสามารถเอามาใช้ในงานวิจัยชิ้นนี้ได้อาจารย์พยายามยกตัวอย่างแบบนี้เนาะโอเค
Now, if that IRB person says no, I have grounds for a grievance against the IRB. Now, you don't want to ever go for a grievance, but typically, many of us get frustrated with the IRB and do the scientific equivalent of saying, you're an idiot. You don't know what you're talking about. They're humans. We want to avoid that. So just like you would be creating an argument for why you would be answering a research question or taking a specific approach, you have to do it very systematically. Acknowledge what they said and then do a counter argument with citations, etc., etc.
ครับอาจารย์ก็บอกว่าบางทีเมมเบอร์ IRB อ่ะเนาะก็คิดต่างจากเรานึกออกไหมอย่างเช่นบางที IRB บางสถานที่เนี่ยคนที่เป็นกรรมการ IRB ก็อาจจะมาจากศาสตร์อื่นๆที่ไม่ใช่พยาบาลสมมุติอย่างเงี้ยเขาก็ไม่เข้าใจเขาก็อาจจะคิดในมุมของเขาว่าเอ๊ะมันทำไม่ได้มันน่าจะเป็นอย่างนี้ อาจารย์ก็บอกว่าเราก็ต้อง argue ก็คือแบบให้เหตุผลเนาะว่าเขาให้มาแบบนี้แต่วิธีการให้เหตุผลที่จะทำให้ IRB อันนี้ได้เนี่ยไม่ใช่ไปบอกว่าฉันจะทำแบบนี้อะไรเงี้ยมันก็ต้องมีกลวิธีโดยเป็น systematic ใช่ไหมครับก็คือเอา reference มาบอกถึงว่าเพราะอะไรเพื่อที่จะให้เขาเห็นถ้าเราไม่มีเหตุผลไม่มี reference มันก็ไม่มีน้ำหนักเพียงพอเนาะก็เอาสิ่งเหล่านี้มาพูดให้มันเป็น system นะครับในการ explain นะครับ
I spent a little bit of time talking about this because it's such a common issue. It's such a problem. And then as we're just learning to deal with the IRB, oftentimes we make mistakes that actually make it worse for us. So stay calm, get your facts all in order, and provide a good rationale for why you want to do something differently. In most cases, we will agree with the IRB. The IRB says, change this word to this. We say, yes, of course. Thank you very much. You're brilliant. Thank you. But where sometimes it is necessary to provide an alternative, an approach. So just do it in a way that will help them to accept from the scientific literature the argument that you're making.
อาจารย์ก็บอกว่าจริงๆแล้วเวลาทำ IRB ทุกคนจะมีปัญหากับ IRB โดยตลอดแล้วก็ควรจะ response ในทางที่ดีเพื่อไม่ให้มัน worse ไปกว่านั้นถูกไหมเพราะว่าถ้า worse ก็คือโดน reject เพราะฉะนั้นโดยส่วนใหญ่เนี่ยพอ IRB comment อะไรมาเราก็มักจะ follow ตามในประเด็นที่เราคิดว่ามัน make sense แต่ในบางประเด็นที่เราคิดว่าเรา based on literature เรา based on systematic ที่เรา create มาอย่างดีเนี่ยเราก็สามารถอธิบายได้มาอย่างที่อาจารย์บอกเรื่องแบบนี้ก็คือให้มันเป็น system อธิบาย rationale อย่าง very strong เนาะให้มัน make sense แล้วเขาก็จะได้เข้าใจเช่นเดียวกันไม่ใช่เปลี่ยนไปซะทุกอย่างไปตามเขาหมดเพราะบางทีเขาก็ไม่ได้เข้าใจในประเด็นที่เราทำประมาณนั้นครับมีคำถามอีกไหมไม่มีใครอยากแชร์อะไรอีกไหมครับไม่มี all good all good You learn a lot. You are so lucky. You are so lucky that you learn from Professor Dr. Matthews. So I'm very happy to have you here. And I know even though we are not a lot of audience, but most of us who you join in the previous session before too. So it means you engage in all steps that we prepare for you to do the good research. So thanks a lot on your collaboration. We still have other topics, right? You know that we still have other topics and also for next week too. Please feel free to join for the next time of the lecture. So far today, I would like to say thank you so much to our keynote speaker again. Can you click the heart button on your screen for Dr. Matthews? Yay, let's see. And smile too. I'm gonna capture that. 1, 2,